Medicaid expansion advocates filled the state capitol yet again this afternoon, calling for lawmakers to reach a deal on Medicaid expansion. With both chambers passing a version of expansion, the issue will be going to conference. Advocates are urging lawmakers to agree on a measure that would fully expand Medicaid to 138% of the federal poverty level, a little over $20,000 a year for one person. Advocates say that this would impact the most people that fall in the coverage gap that are left without health insurance.
This isn't just about numbers on a budget line. It's about real people, working class Mississippians who deserve better. Yeah. It's about children who shouldn't have to go without essential medical care. And about mothers who should never have to choose between paying for a doctor's visit and putting food on the table.
12 News senior political correspondent Richard Lake spoke with one of those individuals in the coverage gap. Richard?
Well, Byron, roughly 200,000 working Mississippians would have the option of health care if Mississippi fully expanded Medicaid. I spoke to just one of those Mississippians this afternoon and asked him how him and his family make ends meet while navigating life in the coverage gap. This is Ken Allen. He currently works as a custodian at Southside Baptist Church in Jackson.
Myself or my wife, anytime that we've been, in a situation where both of us were working or just one of us was working, we've never made over $2,000 a month take home. There's not really a lot of options for me out there without insurance.
His last job offered insurance, but the premiums proved to be too expensive for him to afford. Ken left his last job over safety concerns and has been working at Southside since November. Since then, Ken, his wife, who suffers with diabetes, and his 2 teenage children are left with no health insurance. They've applied for Medicaid 4 times just this year and have not yet been accepted.
Either we make too much, or like I said, they want some document from 10 years ago showing that you don't work somewhere that you used to work.
Ken works 4 days a week at the church and spends the rest of his week cutting lawns and doing other home repairs around Jackson, often without a steady income.
Dealing with the burden is very frustrating, when you see your wife's ankles are swollen because she's retaining water, and it has to do with her diabetes and different things like that. Or your child has 101 fever, and you know that there's really nothing that you can do other than give them a little bit of over-the-counter medicine. Personally, I don't want any government assistance. I feel like I've got 2 good arms and a strong back. So I want to go out and make for my own. And I want my children to see me do that. The Medicaid expansion could provide those answers, if nothing else, then temporarily for those people that are in my situation, that are working and doing the best that they can.
With Medicaid expansion talks headed to conference, Ken, along with roughly 200,000 other Mississippians, are hoping lawmakers can agree on a measure that will include those making up to 138% of the federal poverty level. That's a yearly income of $31,200 for a family of 4 like Ken's.
Well, if you say you're for the people, then, give them what they need in order to take care of themselves.
Now, House and Senate conferees have been named, but it is unclear when lawmakers will reach an agreement, if at all, on a plan that would expand Medicaid. Reporting live from the state capitol, Richard Lake, 12 News.